Well, hello. We are here today with Dr. Alice Leanne. She's our alumni and graduate of our Dental Public Health Residency Program. Here at A.D. Still University and College of Graduate Health Studies, especially Public Health Department, we have three online programs. We have MPH, we have MPH Dental Emphasis, and then we have Dental Public Health Residence Program. And I am a chair and professor of the Public Health Department here at the College of Graduate Health Studies. And today I am pleased to talk with Alice about our program. So please, Alice, can you introduce yourself and tell us what inspired you to choose our online Dental Public Health Residency Program?
Hi, Dr. Gold. Thank you for having me. So even during my dental school training, I was always interested in public health, but at that time, I just didn't know how to pursue it. And after graduating and working as a general dentist in different settings, including private practice, federally qualified health centers, that's when I saw firsthand what oral health disparities look like. And I wanted to be a part of the solution at a bigger population level.
That's great. Was there anything particular concentration or unique feature of the program that really attracted you to come to us?
Yeah, sure. At the time of application, I had two very young children and I was not in a place to relocate. So if it wasn't for the fully online feature, I don't think I could have done it. And also most dental public health residency requires that programs require that you have an MPH already, but ATSU is unique that it combines the MPH with the residency. And not only that, ATSU's MPH has a dental emphasis, which means that most courses and most projects are directly relevant to dental public health, which I think is amazing. And so that means that like the academic foundation is reinforced with the practical training of the residency, which I think is one of the greatest strengths.
Thank you so much. This is really unique program nationally. Mm-hmm. I'm so happy to hear that. So when you enrolled, what were your goals, like professionally or even personally, and what you were hoping to gain from this experience?
Yeah, so my professional goal was to deepen my knowledge of dental public health, and so that it'll open up opportunities to work beyond clinical setting, because I really wanted to make an impact at a broader community level. And for personally, I hope to be a great model for my children, showing them what it means to really value meaningful work that serves the community and care about things beyond ourselves.
That's great. So let's talk about the program experience. So how would you describe your overall experience as a student or as a resident in the program?
Yeah, overall, it was an excellent experience. Even though it was online, I never felt alone. And the faculty were always available, supportive, and I really felt like they were invested in my success. And so their mentorship and constructive feedback throughout the course really helped me to grow.
That's excellent. So how did the online format support or challenge your personal or professional commitment? You already mentioned you had two children, so can you elaborate that?
Yeah, exactly. So the online format was what I needed. And it gave me the flexibility to balance my raising my children also with my studies. And early on, so it even allowed me to work part-time before I eventually decided to step back from my job. And the asynchronous structure means that you really need strong time management skills, and you really need to be on top of your assignments. But the program overall, I believe, is designed so that you don't have to totally give up your professional or personal commitments.
Indeed, there's a lot of flexibility built in the program itself. Yeah. Excellent. So was there any particular course or any project that stand out as especially impactful to you?
Yeah, I think every part of the program felt very important. Like each course is building onto the next, like a puzzle coming together. But if I had to choose a few, the dental healthcare policy and management and the financing dental care courses stood out the most for me. I think because they were challenging, because the concepts were new to me, but the content was very current and directly relevant to real world issues. And so they really pushed me to think critically about how policy and financing shape access to oral health care. And I think that perspective will continue to influence my future work.
That's excellent. We are really trying very hard to modify and revise our program and the courses that really make the students and residents ready for the real world and practical applications.
Mhm.
I'm so happy to hear that. So, do you feel that this degree has elevated your credibility or effectiveness in your field? And if so, how?
Yeah, I definitely hope so. I believe that it adds credibility because now I bring a public health perspective in addition to my clinical experience. And the program also prepared me to successfully pass the qualifying board exam administered by the American Board of Dental Public Health. And I am planning to take the certifying exam next year, which will be the ultimate credential as a dental public health specialist. And as I look for new opportunities, I know that the training I had will make me more effective in improving oral health outcomes at a community and population level.
That's amazing, and congratulations for passing those exams, and
Thank
good
you.
luck for the future exam. And I'm sure you will pass with the high rates. And thank you so much for coming to talk with us and with me today, and all the responses. Do you have anything else that you want to add before we close?
Oh, yeah, no, I really wanted to say thank you for all the support that I've been given. And I really think that this is a unique program that I'm really so proud to be a graduate alumni of.
Thank you so much, Alice, and good luck.
Thank you. Bye, Dr. Gold.
Bye-bye.